Okay, so last two, palpation, the pubic symphysis. Remember, there is a disc here. So when the ilium is rotated, there is going to be some movement here at the pubic symphysis. So oftentimes what I'll say to the patient is, I want you to put your own hand on your stomach and kind of slide down until you feel a bone. And they can kind of usually do that. Sometimes it will be tender, which clues you in if there is any inflammation or irritation around that disc. Oftentimes helping you to confirm that SI joint issue you're suspecting. And then if they are comfortable and you are comfortable, you can kind of see, do you feel a difference on the left side versus the right side? Cluing you in if there is truly a rotation occurring, right? So if this is a left anterior iliac rotation, this left pubic symphysis will be inferior relative to the right. The last thing on your sheet, it's called the sacral float. So the patient is going to be lying supine, and what you are going to do is you are going to put your hand under their sacrum, okay? And with your hand there, your hand is going to be taking note of the position of the sacrum. So as you slide your hand underneath them, they can do a bridge to kind of lift up. You will be feeling, how much weight do I feel on each aspect of my hand? Do I think that sacrum is nutated, right? So is that sacral base a little bit more anterior with more of the weight from the apex in my palm? Is it counter-nutated? Then I'd feel more weight kind of up in my fingers, less on the palm. Or do I feel a rotation? So can I kind of notice that one side is pushing down farther into my hand relative to the other? Remember, rotation is named by the anterior aspect of the sacrum. So if this patient in front of you has a left sacral rotation, okay, so that means that sacrum is doing this, then you are going to feel more pressure on the left side, and it's going to be a little bit anterior on the right side. So the left side of the sacrum will be more posterior, and the right side of the sacrum will be more anterior, creating a little bit deeper of a sacral sulcus on the right side, or a more shallow sacral sulcus on the left side when we're talking about a left sacral rotation. All right, so I'm going to go ahead and show that on a real person. So one thing I want to mention is the concept of leg length discrepancy. All right, so when we're looking at leg length discrepancy, you can use your tape measure and to measure from the ASIS, remember that inferior border, to the medial malleolus. You then flip that patient over and you measure from the PSIS to that medial malleolus. You compare those values to the opposite leg to determine whether or not you have a true leg length discrepancy versus the other. For alignment, you're going to have your patient perform a bridge. So go ahead and lift up and then come back down. And then I like to straighten their legs out for them so that they're just nice and flat. I'm going to come in and use my dominant eye. My dominant eye is going to be the eye that is kind of more in the midline of that person's body. So I always stand on the same side of the table. Come in with my thumbs, going to palpate under ASIS. Look for that alignment and determine which one is inferior relative to the other. Okay? Again, if I was measuring, I'd put my tape measure right here, zzz, to that medial malleolus. Okay? Compare that down to the opposite side. Patient flips over. Actually, maybe sit facing that way. For PSIS. Okay, I'm going to show PSIS in sitting. Okay, again, I come underneath and then I can feel that PSIS position. Okay, if I was just on top of it, I can be in various positions. So be sure you come up from inferior till you hook underneath. I'm going to look with my dominant eye and see, is there a difference in position on one side versus the other. I'll stop there.